Hi everyone, this is Examination 4's notes, and we'll start with universal precautions against HIV. You want to treat all blood and other bodily fluids as if they could be infected. HIV, human immunodeficiency syndrome, is um, where the beginning stages of AIDS will start, unfortunately. It is still very popular in other areas of the world, and there are still um, several 100,000 people in the United States with HIV, but the drugs have helped tremendously over the last 20 years. Magic Johnson raised awareness in this area, and people are able to lead normal lives much differently than they used to, um, even living with HIV. So we'll be talking about jumping around a little bit with HIV, infectious diseases, cardiovascular disease, um, and then talking about drugs, alcohol, and tobacco for this final exam. Um, a heart attack is the death of the heart muscle due to a lack of blood flow, and CPR is one of the methods that can help keep oxygen flowing to the brain, which is the goal of CPR. Isn't necessarily to revive somebody, but to make sure that with cardiopulmonary resuscitation, known as CPR, that oxygen remains continuous to the main organs, namely the brain, because within 10 minutes a person can die without having proper oxygen. A new theory about heart disease is that the blockage of coronary arteries may occur because of inflammation. And inflammation can occur um, in a number of different ways over time, and that's why starting proper healthy behaviors at a young age is so important. Also, talking about chronic diseases with regards to not only heart disease but diabetes, for example. It's important to monitor and manage blood glucose levels. There's the glycemic index in foods, which is the amount of sugar in each food, and that impacts a person and their cells every day when they're eating. So, if you have a family history of diabetes, this is also something that's important to take into consideration. Um, Type 1 diabetes means that you're insulin dependent, it is genetic, and type 2 diabetes means that you are able to, with controllable factors, change the outcome by exercising and diet, namely. There are drugs that can help, but it's hugely important to exercise um, 3 to 5 times a week for 30 to 60 minutes, and making sure that you're taking into consideration the fitness components that we've talked about in some of the recent notes that we've talked about, and as well as making sure that your diet contains the proper percentages of protein, carbohydrates, and fats, and minimizing foods with high glycemic indexes. So, as we age and as we teach these healthy behaviors to young children, we're trying to avoid chronic health conditions that are persistent and reoccurring over the course of one's lifetime. The most common type of cancer, talking about cancer, is skin cancer. And especially demographically, being here on the West Coast, it's important to use sunscreen, as we've talked about a little bit in some of the earlier notes. Um, some of the treatment for cancer is immunotherapy. Obviously, there is radiation treatment, which is more localized to a specific area, and chemotherapy is um, running chemicals throughout the body. There is localized chemotherapy now that's been in place for the last couple of decades. And there obviously are side effects from chemotherapy. A lot of children, unfortunately, have to endure cancer, and there have been major advancements with regards to the treatment of cancer. And again, as always, early detection is the most important factor in helping cure and help people become in remission with regards to cancer. We have active and passive immunity. Active immunity from an infection, for example, is when your body makes antibodies for it, and passive immunity is when there's an outside source, like immunizations, that helps make antibodies. You basically have, with regards to different types of pathogens, you have the two main ones that we focus on are bacteria and viruses. Bacteria, as we've mentioned, is more like a potato, a baked potato, and a virus is more like an ant, whereas a baked potato is very large comparatively, and a bacteria does not need a host cell to replicate, whereas a virus or the ant does. So not only is it hiding in a host cell, so it's very difficult to study and locate, but a bacteria is much larger, and that's the reason why for things that are bacterial, antibiotics are very oftentimes able to cure, whether we're talking about a sexually transmitted infection or some other bacterial infection, whereas viral infections cannot. Tetanus immunization should be given at least every 10 years. And there's a number of different viruses when it comes to colds. There's a lot of debate with regards to the flu shot. So you just have to, make an informed decision with regards to immunizations and flu shots. Pneumonia can be caused by a bacteria or a virus, interestingly. So as we talk about, jump around a little bit talking about STDs, some men who are infected with chlamydia have never had any symptoms, and a lot of times this is what happens with sexually transmitted infections, as we've mentioned before, that up to 90% of certain sexually transmitted infections have no symptoms. Genital herpes, for example, will show symptoms rather quickly, but for other people it may take months or years, as it might be dormant. So again, a lot of people, most sexually transmitted infections have no symptoms. As far as immunizations go, there's always new recommendations, so you want to go to the Center for Disease Control website, cdc.gov, and make sure you're staying up to date, especially with children, in terms of recommendations and anything that might be going on in terms of epidemics or pandemics in the United States or worldwide that you need to be aware of. There's still some misconception about HIV. It can only be spread through bodily fluids, and not necessarily in other ways that people think, through kissing, sharing towels, sharing utensils, sharing toothbrushes. Other sexually transmitted infections can occur as a result of the aforementioned, but not HIV. There is treatment to reduce the risk for a pregnant HIV-positive woman to pass the virus to her unborn child. So there have been a lot of advances in this area, and so this is good news, because a lot of times pregnant women don't even realize that this has occurred. So to be able to have a cesarean section, for example, because a lot of times where the HIV virus is passed to the unborn child is through the birth canal, so a cesarean section a lot of times will prevent this transfer from happening to the child. When a woman's pregnant, you can have gestational diabetes, which means that they have essentially diabetes while they're pregnant, but afterwards, their blood sugar levels return to normal. Blood pressure can also increase during pregnancy, and anything above 140/90 is considered having high blood pressure. Stress can cause your blood pressure to rise. So a lot of things that you want to do to try and maintain healthy lifestyles, especially when you're pregnant, Um, Cancer, again, occurs very often in the United States, and in certain populations has become the number one cause of death in the United States. Cardiovascular disease is still number one, but with people that are older, it has changed dramatically in the last couple of decades. Um, the common cold, influenza, pneumonia, and tuberculosis are all respiratory infections. So you want to make sure that, especially during flu season, that you're paying attention to the symptoms, and if you've had children yourself, or teachers in particular, know the protocol for how the schools handle certain outbreaks. Notices will go home via email, and there's often things that are shared with families that go home in their folders. But it's important that everyone is on the same page, so that we minimize the risk of sharing certain infections, so that it's minimized with regards to the total population. A lot of kids experience asthma, and they don't necessarily even realize it until there's an episode, and it's a reaction that causes the bronchial tubes to constrict, and a person can die from having an asthma attack. Genital warts can be spread by sexual intercourse, vaginal delivery of a baby, as we mentioned, infected linens and clothing. So this is again one example where it's not necessarily through bodily fluids. Syphilis occurs in 3 stages. You have primary, secondary, and tertiary. And the thing to keep in mind with regards to syphilis is that any damage that has occurred prior to the infection being caught and being able to have medicine, antibiotics to help with the problem, that you can't reverse anything that's already occurred, but you can stop any further damage from taking place. The most effective way to avoid the most effective way to avoid infection with regards to sexually transmitted diseases is abstinence and monogamy, and just promoting good healthy habits at home and in the schools, or even in the prison systems, wherever it is that we're talking about, can dramatically improve not only individual health, familial health, community health, but our health as a nation, and worldwide as well. You obviously need to have good resources and a collective effort to educate and to help young children in particular have healthy behavior, again, starting at a very young age. We're going to be talking a little bit about tobacco, alcohol, and drugs now. There's different categories of drugs. Stimulants, which stimulate the brain and the body. Depressants, depress the brain and decision making and the body. You have inhalants, which are abused and used more in particular with young children. You have narcotics, opiates, which are painkillers, and then you have marijuana. So all the categories mentioned except the latter, marijuana, can kill a child or an adult with one use, and that's why marijuana is in a separate category all by itself, because it has not been known from one use to kill somebody. But marijuana has become more popular, obviously, in the last 2 decades. Has different effects on different people. It can impact some people by causing them to have panic attacks. For others, it can help reduce the number of panic attacks. For some people, it can help them to control blood sugar levels. So those that have diabetes, it can help monitor and control blood sugar levels. And so overall, it can help some people be more calm. It can help some people to become more agitated. So it's important that you check with your medical professional, because a lot of times you don't know, with regards to drugs and alcohol, the effects that these things will have on you. And when you're experimenting, if you're unable to stop the behavior because chemically your body has become, even with just one use or abuse, addicted, you're going to need some help, familially, and with your family, as well as with probably a health professional, um, just for the chemical reasons alone that cause you to crave these drugs or alcohol. With regards to drugs, a lot of times they're used and abused not necessarily because they're intrigued or interested or experimenting with the harder drugs like cocaine or methamphetamines, hallucinogens, but because they experimented with gateway drugs earlier, smoking cigarettes or experimenting with marijuana. And so these gateway drugs lead to more risky behaviors, and then these risky behaviors have an effect on teenage pregnancies, because the choices that they're making while on drugs and alcohol are obviously impacted. So there's like a snowball effect when it comes to these things, and children are going through hormonal changes growing up, and the social component that we've talked about, being influenced by friends and social media, can be very powerful. And then you combine mind-altering substances, it can be very detrimental and lead to death and very poor decisions in many instances. Drugs that relieve pain are known as analgesics. The greatest danger of using a stimulant is they can kill the user, as is the case with other categories. Inhalants, depressants, opiates can kill you with one drug use. Methamphetamines are easily produced, and that is why it's so popular and has been for several decades. A club drug known as ecstasy, or MDMA, can endanger the health by causing heat stroke. The difference between some of the drugs, again, is how they impact the brain, and the drug type in terms of method of taking the drug that will reach the brain the fastest and impact us the quickest is an inhalant. So not an injection, not swallowing, but something that is inhaled. Drug misuse is a problem in certain areas that are close to our borders, because again it has to do with supply and demand and cost. So we, especially here in San Diego, have to be very cautious of a lot of the drugs that are coming into our country from the south. So with regards to alcohol and smoking, again, these gateway drugs, if you've noticed, there's never any ads on television with regards to smoking. The government does not allow for this. There are subtle hints that happen in movies and in television, but for the most part, smoking has gone down over the last 25 years. When for the first 30 years, after the first Surgeon General's report came out in 1961, smoking went up for 30 years. But once cancer and heart attacks came to the forefront, and the percentages showed that the number one behavioral factor causing all types of cancers, not just throat or oral or lung cancers, was a result of smoking and tobacco products, and cancer as well, and cardiovascular disease. Smoking has gone down over the last 25 years, along with better education, teaching young people the dangers and showing them visually what can happen as a result of behavioral factors that contribute to the top causes of death in the United States, which are cardiovascular disease and cancer. Young people have to be really cautious also with regards to alcohol in terms of binge drinking, which is consuming large amounts of alcohol too quickly can cause a person to pass out. The body can be depressed, the heart can be depressed, they can die. Children whose parents abuse alcohol also statistically show that they will also have a problem with alcohol as they get older. Smoking in the household, in addition to alcohol issues, can be a really deadly combination. Side stream smoke and secondhand smoke can cause cancer, and people don't realize that if they're just exposed to smoke, even if they're not smoking themselves, can put them in a huge increased risk, especially because of the developmental things that are happening with children, and the smoke can impact the ability for the child to grow and develop properly, and can put them at an increased risk as they get older for cancer and even heart attacks and strokes. According to the FDA, talking about drugs, a safe drug does not cause harm or have side effects. It's not a threat to the population, and it can save lives. Drugs that have calming effects on people are known as sedatives, whereas hallucinogens cause you to hallucinate and can cause long-term damage to the mind, as well as marijuana. But a lot of times, the good outweighs the bad, and this is something that people are willing to live with. It's important to be involved in school activities because it's a hugely important and proven protective factor for drug use and abuse. Education and programs can definitely help reduce the amounts of unhealthy behaviors that a child engages in. Unfortunately, a lot of times children are scapegoats and blamed for family problems and why people abuse drugs and smoke, and so this can cause a long life effect on the kids. Most people who are on drugs are in denial about it, so this is really unfortunate, especially with parents or even the children, and then the parents are in denial about it and enable the kids' behavior because they're in denial about the fact that there's an unhealthy behavior going on, even though the signs are all there. Alcohol use leads to violent behavior mainly because of impaired judgment. The greatest negative effect, health effect of nicotine is that it just causes a dependence on tobacco products, which in the long term, as we mentioned, can cause an increased risk of the top two killers in the United States, heart attacks and strokes. But there are solutions. There are programs out there. There's nicotine patch and gum that are designed to enable smokers to gradually taper off nicotine dependence. There's Alcoholics Anonymous. There's different programs online. There's books that are intended to help educate and can help people to better understand the impacts on their bodies and their minds, and how there are alternatives and programs to help people that are using and abusing drugs and alcohol and even smoking to stop these behaviors. So again, in summary, it's very important to eat healthy, maintaining the proper amounts of protein, between 15 and 25% of protein a day. The good sugars, between 45 and 65% of your diet should come from sugars and less than 20% from fats, mostly healthy fats. Eating 3 to 4 hours a day, making sure that you're drinking proper amounts of water, at least a half an ounce of water per pound of body weight that you weigh. Eliminating the unhealthy behaviors, smoking, drug use, and making sure that you eat, again, in a healthy manner, making good choices and becoming educated on diet and exercise. Exercise can change people profoundly, and if we do this from a very young age, it can help monumentally in the long run.